This morning, we're learning more about the state's move to open health insurance coverage to all Washingtonians, including people without documentation. Buying health and dental insurance can be a challenging process for anyone. Joining us now to talk about this is Ingrid Allred, the CEO for Washington Health Benefit Exchange. Thanks so much for being with us, Ingrid.
Farah, thank you for having me. Now is a critical time for people to make sure they're covered for 2024. Health insurance, as you said, is complex, it's expensive, and I think the thing for your viewers to think about is most people in our state get their health insurance through their employer or through a government program such as Medicare if they're 65 years or older, or through our state's Medicaid program, which is called Apple Health. But if you don't fit into one of those buckets, it's very important to know that the place to go to purchase health insurance for yourself or your family is through our Health Benefit Exchange and the online portal that we run, which is called Health Plan Finder, WashingtonHealthPlanFinder.org.
And when people aren't insured and they need health care, what type of an impact does that have overall in the state on the healthcare system?
Health insurance is really fundamental. It is really the ticket that enables us to see a doctor if we feel ill, to manage chronic care conditions, and it's essential to protect people from financial ruin if they become seriously ill or injured. So for having people uninsured, it puts them at great risk individually, and it's bad for society overall. It's destabilizing for our health insurance system, because when people get sick, they end up in the doctor or the hospital anyway, but their conditions have worsened because they have delayed their care. So it's important for stabilizing the healthcare system, keeping people healthy, as well as strengthening our economy, ensuring that we have stability of our workforce. And it's just the right thing to do.
Well, and you mentioned some categories that people might fall into, and then if they don't, or they're concerned about cost. I think that's what it comes down to a lot for people, and they think, I'll put it off, I'm fairly healthy, I can't afford that other cost. Some low-income earners may actually qualify for some assistance or some lower coverage.
That's correct, and WashingtonHealthPlanFinder.org is the only place to go to gain access to available federal and state subsidies that can make health insurance very affordable, especially for low and moderate income Washingtonians. So I would encourage people, if people are delaying, they're concerned about the cost and the complexity, go into WaHealthPlanFinder.org. They might be surprised, and there's availability of federal subsidies, as well as looking out for Cascade Care plans, which come with an additional state subsidy to help people afford the coverage they need. And new and exciting this year is that these plans are available to all Washingtonians, regardless of citizenship status. So we know that 1 out of 4 of the remaining uninsured in our state are undocumented, and this year, historically, we are welcoming in all Washingtonians to purchase health coverage at healthplanfinder.org.
All right, great information. We have the website on the screen right now for you. And Ingrid, in case people aren't up to using a website, there's a phone number?
There is lots of help available. The phone number is 855-923-4633. Our folks pick up the phone very quickly. Help is available in more than 220 languages or online. Encourage people to get covered for 2024.
Super.
Thank
Ingrid,
you.
Thank you so much.